last night and in the months preceding it, President Obama has been talking about a need for healthcare reform in America. In fact, the White House website states that 15% of Americans do not have healthcare coverage, and that the average American family has seen their deductibles raised by 30% over the past 2 years. Another source on the White House website stated that 50% of all bankruptcies can be attributed to the rising healthcare costs. I agree with President Obama that we should have healthcare reform in America, but it should not just focus on the uninsured or the underinsured. It should contain 3 different elements: educational reform, system reform, and insurance reform. President Obama stated in a town hall meeting broadcasted on ABC that he wanted to increase the number of providers. But the only way to increase the number of providers in America is through our educational system. So starting with that reform, we need to reduce the time and money it takes to become a medical provider. The average doctor has spent 12 years and $300,000 becoming what he is today, or she is today. Nurse practitioners, PAs, have all spent a minimum 6 years in school and over $100,000 in their education. I believe we can reduce those timelines and those costs. We can reduce doctor times from 12 years down to 8. We can reduce PAs and nurse practitioners from 6 years down to 4. This will inevitably reduce the cost from $300,000 to maybe $100,000 to $200,000. Also, for nurse practitioners, bring it down from 6 years to 4 years. We can reduce that $100,000 maybe down to $60,000 or $80,000. I believe we can make these reforms. Next, we need to take the costs out of Medicare. As some of you know, and some of you may not know, that the last 3 years of the medical school education is spent in residency. Well, residents are paid during that time because they're actually providing service, but they're paid out of Medicare money. This includes foreign students who have transferred just for residency. They are paid an average of $45,000 to $50,000 every year through our tax dollars, only to leave after their residency and go back to their home country, us not gaining anything from their education. We also need to expand our program availability through good recruitment at our high schools and at our lower bachelorette level colleges. Through this recruitment and the expansion of residency programs in all different fields of medicine, we can increase the number of providers President Obama so dearly wants, and we can do it by reducing the cost of the overall healthcare education. So now that we have fixed the education, we need to move on to our system, because our system is broken. The last time you were at the emergency room and you got the bill for it, did you notice the price of some of the things that they gave you? $10 for a Band-Aid, $30 for a Tylenol. I believe these costs are wrong. If you can go down to the CVS or the Rite Aid and pick up a prescription for $8 for 30 Tylenol, then you should be able to get that same price at that hospital. This also includes the time that you would spend with a provider or the procedure that was done. There should be standardized costs across the board. Over the past few years, we have made great strides in expanding our electronic health records. But the problem with it is that they're only talking to themselves. They don't talk to other providers. They don't talk to the laboratories. The PCMs can't talk to the specialties. Specialties can't talk to the pharmacies. And the insurance companies can't talk to anybody. I believe all of those elements need to be included into one system. That way we can have a transparency of care and continuation of care that every patient deserves. When we have that transparency, we can inevitably reduce the amount of errors in the medical profession. In fact, a Journal of American Medical Associates article stated that 225,000 people a year die from medical errors. That number is way too high, and we need to reduce it. Speaking of medical errors, it brings us on to insurance. And most citizens in this country are only concerned with their health insurance and dental insurance. Well, for doctors and providers, they have to also worry about their malpractice or liability insurance. By reducing the errors I mentioned in fixing our system, we can inevitably reduce the amount of liability and malpractice insurance that our providers have to carry. But in doing so, we also have to make sure that when we reform the insurance, that we get rid of the frivolous lawsuits, but at the same time leave it open to where true malpractice suits can be filed. After we fix the malpractice and the liability insurance, we need to move on to actual healthcare insurance that affects everyday citizens. Medicare and Medicaid were set up by the government to provide health care for the impoverished or the uninsured. I believe these programs can be expanded to where they offer the same coverage that one of the major civilian insurance companies can provide. But I also believe that we can expand our government-provided insurance for our government employees to small businesses or self-employed citizens. By doing this, we can open the insurance coverage up and reduce the costs across the board. When I talk about reforming the civilian insurance companies, I want to make sure that they are providing insurance at the same cost they would to every other citizen. Excuse me. There should be no costs that one person would pay that another person wouldn't. Also, insurance companies should not be able to say they will not cover you because of a pre-existing health concern. With these reforms in our insurance companies and our insurance system, we can reduce the costs again across the board. President Obama is truly right. Our system has long since needed healthcare reform. But we need it more than just in our healthcare system. It should also, in our insurance system, it should also be included in our educational system and in the system itself. I thank you for your time.